Chapter 2 of ICD-10-CM is for neoplasms. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example and quiz, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letters C and D, and if you remember from ICD-9, these codes all started with numbers 1 and 2. However, the list of sections in ICD-10 is much more detailed than ICD-9. As in ICD-9, ICD-10 includes a neoplasm table, which starts on page 321 of the 2015 Optum ICD-10-CM Expert for Physicians Manual. Just as in ICD-9, the type of neoplasms in the table are primary, secondary, in situ, benign, uncertain, and unspecified behavior. I want to point out that the term in situ, which is categories D00 through D09, indicates an early type of cancer. The cancer has not yet moved to the cells and surrounding tissue. This is a precursor to cancer that, if left untreated, will become a malignant neoplasm. You're only going to use a code for neoplasm of uncertain behavior from the neoplasm table when the tumor is showing both benign and malignant behavior. These codes can only be used when documentation clearly indicates that the behavior of the neoplasm cannot be identified. If instead documentation does not indicate the behavior of the neoplasm, you're going to use a code for an unspecified neoplasm. This may happen when a new patient who is formerly treated at one facility comes to a new facility without any records, or if a workup isn't performed due to a patient's advanced age or poor condition. However, it should be uncommon to use the codes for neoplasms of unspecified behavior. For coding neoplasms, you are generally going to start with the neoplasm table. This is unless the histological term is documented, in which case you're going to look up this term in the alphabetic index. For example, if adenoma is documented, you would find that term in the alphabetic index. There is then an instructional note which states, "See also neoplasm by site benign." This means that the correct code will be found by going to the neoplasm table, finding the anatomic site, such as the thyroid, and then using the code listed in the column for benign. For a thyroid adenoma, this would be D34, which according to the tabular is benign neoplasm of thyroid gland. As with any portion of the webinar, you may wish to pause the webinar so you have time to follow along in your ICD-10 manual. Let's do a coding example. This patient has small cell carcinoma of the right lower lobe of the lung with metastasis to the intrathoracic lymph nodes, brain, and right rib. What are the codes for this patient? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is C34.31, which is for the small cell carcinoma of the right lower lobe. Since we have the histologic term carcinoma, I first went to the alphabetic index and looked up carcinoma, which has in parentheses next to it, see also neoplasm by site malignant. I just checked to make sure that lung wasn't also listed, but since it wasn't, I went to the neoplasm table, then went to lung, Then under lung, I looked for lower lobe. From there, I looked for the code listed under the malignant primary column, since we know the cancer metastasized from there. The code starts with C34.3, but the little checkbox indicates that we don't have a complete code yet, which is another reason why it's vital to confirm all your codes in the tabular list. When you go to C34.3, you have 3 codes, one for unspecified, one for right, and one for left lung. Since documentation states that it is the right lower lobe, C34.31 is the correct code. The order of the 3 remaining codes does not matter. I chose to code them in the order listed in the documentation. I have C77.1 for the intrathoracic lymph node metastasis. I found this code by going to lymph in the neoplasm table, and then I located the term intrathoracic indented underneath. I looked across the table until I found the column for malignant secondary. This is the correct column, as documentation states that the cancer metastasized to this location. The column contains code C77.1, which I confirmed in the tabular. The code for the metastasis to the brain is C79.31. This code was located by going to the neoplasm table and looking for brain. C79.31 is in the column for malignant secondary. I confirmed this code in the tabular. The code for the metastasis to the right rib is C79.51. I located this code in the neoplasm table by looking for rib, and then C79.51 is in the column for malignant secondary. I confirmed this code in the tabular. Note that there is no option for right versus left rib for a secondary malignant neoplasm, and when we confirm the code in the tabular, we can see that it's just not very specific. There are many guidelines for the coding of malignancies. Generally, if treatment is directed at the malignancy would be the first listed diagnosis. The only exception to this is when the patient comes in solely for chemo, immunotherapy, or radiation. In that case, a code from category Z51 must be the first diagnosis, followed by the code for the malignancy being treated, which can be a primary or secondary malignancy. Now I'd like you to try a chemotherapy coding example for ICD-10. The reason for the encounter is to receive chemotherapy following the recent diagnosis of carcinoma of the small intestines in the areas where the duodenum and the jejunum join. What are the codes for this patient? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is Z51.11 for encounter for anti-neoplastic chemotherapy. Remember that since the reason for the visit was chemo, this code must go first. I found this code by looking up chemotherapy in the alphabetic index. The options below the main heading are for cancer and neoplasm, both of which code to Z51.11. I then confirmed this code in the tabular. Our second code is C17.8, malignant neoplasm of overlapping sites of small intestine. Remember that since we have the histologic term, carcinoma, I first went to the alphabetic index and looked up carcinoma, and then went to intestinal type, and then to the indented words. Specified site next to these words is the following instruction: see neoplasm malignant by site. I therefore went to the neoplasm table and looked for intestine. Then I looked for small indented below this main term, and then overlapping lesion. From there, I looked for the code listed under the malignant primary column, as our documentation does not state that this is a metastasized cancer, and I located code C17.8, which I confirmed in the tabular. If documentation states that a patient has cancer that has metastasized, the sequencing of the primary and secondary malignancies depends on which malignancy is being treated. If the patient comes in for chemo for cancer that metastasized from the prostate to the liver, and the chemo is for the liver cancer, this code would go before the code for the prostate cancer. The next series of slides will focus on complications associated with neoplasms. If the patient develops anemia as a result of the malignancy, and the reason for the visit is for management of the anemia, believe it or not, the guidelines state that the first code reported is for the malignancy that caused the anemia, followed by the code for the anemia, such as D63.0 for anemia in neoplastic disease. If the patient's anemia is due to chemo or immunotherapy, and the reason for the encounter is solely for treatment of the anemia, you're going to sequence the anemia first, such as D64.81, anemia due to anti-neoplastic chemotherapy. The next codes are for the malignancy, and then you also need to use the adverse effect code T45.1X5 with the appropriate seventh character for the current episode of care, which is either initial, subsequent, or sequela. Now let's try a neoplasm complications example. A patient was experiencing fatigue and dizziness, status post-chemo for her pancreatic cancer. The physician diagnosed the patient with anemia caused by the chemotherapy. What are the codes for this patient? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is D64.81, anemia due to anti-neoplastic chemotherapy. This code was found by going to anemia in the alphabetic index and then looking for the words due to indented underneath, and then below due to, my first option was for anti-neoplastic chemotherapy with a code of D64.81. I then confirmed this code in the tabular list. Our next code is C25.9, malignant neoplasm of pancreas unspecified. To find this code, I went to the neoplasm table, then went to pancreas and picked C25.9 in the malignancy primary column, as we don't have any indication that this is a secondary malignancy. I then confirmed this code in the tabular list. The final code required by the guidelines is the adverse effect code of T45.1X5A. In order to find this code, you must go to the Table of Drugs and Chemicals in Volume 2 of your ICD-10 book, which starts on page 339 of the Optum 2015 ICD-10-CM Expert for Physicians. This was a little tricky because if you try to look up chemotherapy in the table, there is no listing. Therefore, you have to go to anti-neoplastic and then look across to your right to the column for adverse effect, which gives you a code of T45.1X5. When you confirm this code in the tabular index, you'll notice that a seventh character is required, and our table under category T45 indicates that the options are A for initial encounter, D for subsequent encounter, or S for sequela. In this particular case, documentation states that the physician diagnosed the patient at this visit, so a seventh character of A for initial encounter is appropriate. The order of these three codes follows the ICD-10 guidelines, where the first code is for the anemia due to the chemo, followed by the patient's malignancy, and then the adverse effect code. Similarly, when the patient has anemia due to radiation therapy and the reason for the visit is to treat the anemia, your code sequence will be the code for the anemia, followed by your neoplasms, and then Y84.2, which is radiological procedure and radiotherapy as the cause of abnormal reaction of the patient or of later complication, without mention of misadventure at the time of the procedure. This code is actually located in the External Causes chapter, so in order to look it up, you would go to the Index to External Causes, which for the Optum 2015 ICD-10-CM Expert for Physicians starts on page 387. You then go to Radiation and look for complication of or abnormal reaction to medical radiotherapy. If the reason for the encounter is dehydration due to the malignancy, you would code dehydration first, followed by the code or codes for the malignancy. When the patient comes in for treatment of a complication that arose after a surgical procedure, such as one to remove a malignancy, the complication code would be the principal diagnosis, followed by the malignancy. We're going to try a coding example on the next slide. Here we have a patient who was treated for streptococcal sepsis 2 days after surgery for the removal of a malignant tumor of the lateral wall of the bladder. What are the codes for this patient? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is T81.4XXA, infection following a procedure, initial encounter. Remember that for complications, our complication code goes first when this is the reason for the visit. To code this, you would look up the term infection and then indented below look for the term postoperative. The code indicated is T81.4 and the little checkbox indicates that more digits are required. When we confirm this code in the tabular list, we see that a 7th character is required for episode of care, and since it appears that this is the first time the patient is being seen for the complication, the 7th character A for initial encounter is appropriate. Remember that since the 7th character must always be in the 7th character position, and our code is only 4 digits long, 2 X placeholders are needed for the A to be in the 7th character spot. That gives us a final code of T81.4XXA. The second code is A40.9 for streptococcal sepsis. To find this code, I started by looking up sepsis in the alphabetic index, and then I looked for streptococcal indented underneath. Since we don't know what specific kind of streptococcal infection the patient has, I had to choose A40.9 for streptococcal sepsis unspecified. I then confirmed this code in the tabular index. The last code is C67.2, malignant neoplasm of lateral wall of bladder. To find this code, I went to the neoplasm table, then went to bladder. Indented under bladder is wall, and under wall I found lateral. I then picked C67.2 in the malignancy primary column, as we don't have any indication that this is a secondary malignancy. I then confirmed this code in the tabular index. When a primary malignancy has been previously excised or eradicated from its site, and there is no further treatment directed to that site, and there is no evidence of any existing primary malignancy, a code from category Z85, personal history of malignant neoplasm, would be appropriate. However, if documentation indicates extension, invasion, or metastasis to another site, this is coded as a secondary malignant neoplasm. If the primary malignancy is totally eradicated, you would also code the secondary malignancy with a Z85 code. For the next 4 slides, we're going to talk about chemo, immunotherapy, and radiation. When the episode of care involves surgery to remove the neoplasm, an anti-neoplastic therapy is also performed. The code for the neoplasm should be coded first, followed by the therapy code. Just to reiterate from a previous slide, when the encounter is only for anti-neoplastic therapy, the appropriate therapy code from category Z51 is sequenced first, followed by the malignancy. If the patient has multiple therapies on the same date of service, it doesn't matter which therapy is sequenced first, be it the chemo or the radiation therapy. When a patient is admitted for anti-neoplastic therapy and develops complications, you're actually going to code the therapy code first, followed by the complication codes. For example, if a patient developed dehydration as a result of the chemo they had on that visit, you would code Z51.11 for the chemo first, followed by the code for dehydration, and then the code for the malignancy. When a patient is admitted to undergo a procedure, such as paracentesis or thoracentesis, to determine the extent of the malignancy, and they are also administered anti-neoplastic therapy during this same encounter, you're going to code the malignancy first, followed by the therapy code from category Z51. When the reason for the encounter is pain management due to the malignancy, you're going to code G89.3 for neoplasm-related pain first, followed by the neoplasm code or codes which are causing the pain. If the reason for the encounter is treatment of the neoplasm, and documentation states that the patient is also experiencing pain related to the neoplasm, G89.3 would in that case be an additional diagnosis. When you're using code G89.3, it is not necessary to use another code for the site of the pain because the malignancy code indicates the anatomic site. Code C80.0 is for disseminated malignant neoplasm unspecified, which is to be used only when the cancer has spread everywhere and the provider doesn't know where the cancer originated. Code C80.1, malignant neoplasm unspecified, is only to be used when the provider is unaware of where the cancer started. It should rarely be used as it is extremely unspecific. I wouldn't be surprised if a claim was denied with this code on it. If the patient develops a fracture due to neoplastic disease, which would be a type of pathologic fracture, and the focus of treatment is the fracture, you're going to code the fracture first. Subcategory M84.5 is for pathologic fracture in neoplastic disease with specific codes for the anatomic location of the fracture. These codes also require a 7th character for type of fracture and current episode of care. I will talk more about these fractures in the musculoskeletal system webinar. After coding the fracture, when treatment is for the fracture, you're going to code for the neoplasm. If, however, the focus of treatment is on the neoplasm and the patient also has a neoplastic fracture, you would code the neoplasm first. Just always keep thinking about reason for the encounter. The one exception to that being the anemia caused by the neoplasm, and the patient comes in for anemia. In that one specific case, the neoplasm goes first, but otherwise just keep thinking about reason for the encounter. Finally, it's time for our quiz. Our first question is, if a malignancy has been previously excised or eradicated, and there was no further treatment of that site, what category is reported? Our second question, what code is assigned when the admission is for chemotherapy? Our final question is, when a patient is admitted for treatment of anemia due to a malignancy, what code is sequenced first, anemia or malignancy? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is Z85 for personal history of malignant neoplasm. To look this up, you would go to History in the alphabetic index, then look underneath for Personal, and then look for Malignant Neoplasm indented below this. The answer to the second question is Z51.11. You would go to Chemotherapy in the alphabetic index to get this code. Our third answer is the malignancy. Remember, this is the one weird guideline where even though the treatment is for the malignancy-related anemia, you're actually going to code the malignancy first before you code the malignancy-related anemia. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 2 of ICD-10-CM, Neoplasms. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860. Thank you.